Kia ora koutou and welcome to eHealthTALK NZ. I'm Rebecca Macbeth, I'm the media editor at HINZ, and today I'm joined by Lisa Tumahai. Lisa is the Chief Executive of Pōkeka Poutini Ngai Tahu Limited. Hi there, my Lisa. It's great to have you here. Can you start by telling our listeners about yourself and how you came to be in your role today?
Well, kia ora koutou. Well, for many years, I was on the board of Ngai Tahu, serving my iwi, and also very active within my hapu activities on the west coast, Te Tai Poutini. So Ngāti Waewae and Ngāti Mahaki are the two Ngai Tahu hapu that I whakapapa to on the west coast, and I was very active in that role. And so when I retired from my position at Ngai Tahu, after being on the board for 22 years, so a very long time, it was the right fit to move into this particular role with my working for my two hapu. I had already been actively engaged with the Health and Social Service arm, Poutini Boiwater. So it was just right timing and the right fit and right opportunity coming along. I've sort of always had a career and a life in service, whether that be health, social, education, and a long active career working for iwi.
So for listeners who may not know, what is the mission of Pōkeka Poutini Ngai Tahu?
Yeah, so it's a joint company of the two runanga on the west coast, and at the heart of it, the vision is that our people on the west coast are thriving socially, spiritually, culturally and economically. So our mission is to drive initiatives and developments that deliver on that particular vision. So we have a social service arm, health and social service arm in the organisation, and then we have a commercial arm with commercial investments.
So how does technology enable that work, particularly in the health and social services? Is it an important part of the organisation's strategy?
Yeah, technology is an important enabler across the whole organisation, whether it's the health and social service arm or the commercial arm, because of our location. So we're rural, we're across 3 districts, Bulla, Greymouth and Westland District. Our tribal territory is driving the distance of Auckland to Wellington. So that's the length of the territory, and then inland to the main divide. We may have a small population. There's about 32,000 people that live on Te Tai Poutini, and then the population of Māori is, I think, around 10,000 odd. And so our services are not just for Māori or for iwi, they're targeted at those populations, but they're for all ethnicities. And so without technology, that rural breadth and depth and spread that we have to cover is just not going to work. And also the way that health services are funded. If you're putting a clinical mental health and addictions fund, FTE, on the West Coast to service that territorial location, it's impossible. And you can't do that without having technology and the use of things like telehealth and other technological ways of being able to deliver services to our population.
Great. Can you give any examples of some of the technology projects you have put in place in terms of delivering health and social care?
The first thing was trying to narrow down the CMS systems. So because we have multiple funders, we've health, MSD, OT, Justice, Corrections, Ministry of Education. And so we have multiple different funders, and at one stage we had 5 CMS systems. So you can imagine the way that services are funded, government services are funded, set up 5 different administration functions. You are cobbling all of that funding together in Treasury to provide backroom functions into the organisation. So that includes all of your IT, your finance, your HR, your health and safety, your CMS, your monitoring, contract compliance and monitoring of services. And for your staff, having some user-friendly client management systems that don't require them to do multiple entry. So at one stage we were duplicating at least 3 different times across these 5 different CMS systems. By changing our CMS system and going with Karo management and adapting kotahi, and then looking at how we could ensure sort of that range of different government contracts could be met through that one CMS system, or could we get that system talking to those other systems? So we've managed to currently shrink ourselves down to, it was 3 6 months ago, and we're now down to 2 systems. And it's likely always going to be 2 systems, I think. But I do know that Karo management are doing some work in terms of how can our kotahi system talk to Indice, because our nurses and our nurse practitioners, they enter their data directly into Indice. So we do still have some duplication of data entry. Otherwise, when it comes to reporting and a contract compliance, we're not able to draw data down from the Indice system. So until we sort of solve that problem, we're going to continue having duplication of data entry. Another one that we've done is stood up a digital platform. So we've moved from, manual timesheets, manual ways of filling in incident reports or health and safety to a digital platform. So HR, finance, all of your leave forms, incident reporting, etc., risk management, everything is on a digital platform. And it was interesting when we first put that in place, our staff were going, they've got to go in there and they've got to do their timesheet and they've got to do this and they've got to do that. They've got to do a vehicle check into the digital platform before they jump in a leased car and the pool cars and that kind of thing. So initially we had staff sort of pushing back on it. Now they can't shut up about how amazingly different it has made their jobs and how efficient and effective their jobs are now. So, if you've left work and gone home and you've forgotten to put your annual leave form in, you can just jump online into the digital platform and do it. Or if you are homesick, you can just go online and put your sickness in. It's just an amazing way of doing it. And also a backroom functions team. So HR, finance, health and safety, contract compliance, we're all virtual. So the only people we have to house on site are direct service delivery, frontline staff. So we've got 3 offices across those 3 districts, and it means that we can eliminate some of those cost pressures and the need to have to house more people within office space. And so we have the way that we've structured our contracts and our allowances with our backroom function team to go virtual. And the other thing is we've got staff right along the coast, and we've got a staff member in Christchurch. And so by having a virtual team, who do face-to-face, but it's not every day and it's not every week. But we do enable and ensure that there is face-to-face engagement, so it's not full virtual. But that has enabled us to fill competency gaps when we can't employ the type of expertise we're needing on the West Coast. The last one we've done is just recently starting to use AI. And the more mature we're getting, and building the competency within our staff, and just looking at how we can continue to build on those ways of using AI that are safe for the organisation, and that's underpinned by good policy and values.
Yes, well, it wouldn't be a digital health conversation these days without mentioning AI. So look forward to hearing more about that as it progresses. In terms of frontline care, what's the impact been of technology, I guess, enabling access? You talked about the huge breadth that you cover. Can you just talk a little bit about the impact for patients of having a connection?
Yeah, well, because we're a mobile service and we could be going into homes or community halls, or we could be going to the farm gate. So if I use the annual immunisation clinics, and they're annually, because we are so rural, with the ability now to ensure we can connect teams digitally using either iPads or laptops from wherever they are, what location they're at, as long as those toggles are good to go. And because we know where we're going into certain rural, really inland rural areas, we know where we're going. So we already know what the connection issues are in those particular areas. And we already know what holes to go to if we're going really into the boondocks where, we can get good connection. So being a mobile service and being able to connect it to it's not perfect by no means. There are still areas where it's really patchy and the connection isn't good, but we're kind of learning where those areas are and just adapting the services. And so we're able to go directly into the patient's file into the whatever the electronic online system is with the practice that they're linked to and into their files. And that's, that is part of their data sovereignty, their ownership of their information as well. With immunising, we're able to go into the National Immunisation Register and ensure things are being updated in lifetime. So it's an absolute must for our organisation.
And I mean, digital transformation is never an easy road. You've touched on some of the challenges already in terms of connectivity and some potential early resistance from staff. But have there been any other sort of challenges along the way, and can you share how you've overcome those?
Yeah, we've just we've adapted things like we took on Workflow Max and we were using that for our environmental company. And now that there's been some changes in Workflow Max and that's evolved, and that's the other thing about having a digital platform where you might be using multiple types of apps or within that platform, is ensuring you're evolving and they're updating. And so with Workflow Max, we've just made some changes to how we're actually using that and using it differently. And it's an ever evolving thing as well when you're going to a digital platform. So we have staff who do actively monitor that. And at the moment, I've got my team looking at how we move our governance functions, because we have the governing board and then we have a clinical governance and we have an advisory board. How do we move all of those functions to AI governance mechanisms, tools? So we're constantly looking at evolving. And I think in this particular space, this is just going to be a BAU strategy that's always within our strategic document and ever evolving and learning over time.
So have you built internal capability for this, or do you partner with technology providers to support the journey?
Yeah, so we've done both. We've with in our CMS system, it's a really strong partnership. So when services change or contracts change, reporting changes, contract compliance changes, etc., they will then modify our CMS system and ensure that it's fit for purpose for what we're needing it to do. I mean, we need something that's going to work for us, not something that's going to be really cumbersome and just ineffective. The other great thing about it too, if there are reports that I want that my staff aren't trained in pulling out of the CMS system, we just put a request through to the Karo management team and they'll pull a report for me on the actual stuff that I'm looking for. It's such an ever-changing environment that week to week you think you've got it right and you're looking at the stuff you need to be looking at, and then all of a sudden there's something else you need to do, which your staff may not be aware of how to run that particular report. And so there's that. And then the digital platform, the tools that we use in there are different. Enable HR, Workflow Max. There's a few others. We've developed our own organisational app, which has a whole lot of different tools within it. And that is a mix of internal capability and some contractors that we pull in now and then when we need them.
And so how do you approach issues around data sovereignty and ensure all these digital solutions do align with Ngāi Tahu values and tikanga?
Yeah, and so that's very much reliant on our partner to understand the things that are really, really important to us. So there's the things that are important to us around data sovereignty, but there's also the contractual requirements on us, the compliance around data sovereignty. So the responsibilities that we have under various different acts under our contracts, but most importantly and firstly is our values as an organisation and ensuring that we're adhering to our tribal values. So with data sovereignty, it's hugely important. We're not perfect, but I think we've got the mechanisms in place that if anything goes wrong, people are quick to raise it to your attention. But I don't recall anything going astray on us in terms of our responsibilities to privacy and client information. And I think doing away with paper creates way less risk than staff walking around with client files.
Certainly. It's all a journey, isn't it? It's not like there's an end point at which you can say, right, done that, tick, let's move on. So finally, looking ahead, where do you see Pōkeka Poutini's digital journey heading in the next 5 to 10 years? It sounds like AI might be quite important part of that.
So while we set that digital platform up for the health and social service arm, we've actually rolled it out across the whole organisation and adopted these tools that are in common across the organisation now. Of course, you're not using a CMS system in those other entities, but some of those other digital tools are in common. And we'll keep evolving. We'll keep moving with the ever changes that are happening. I don't have any issue with my staff using AI as long as they adhere to our organisational policy and that we have peer review and we have procedures in place to do those checks, particularly if they're looking at developing a program within the Health and Social Service arm where they're looking to use tikanga, te reo, our culture, our pūrākau, our stories. That is a no-go. So, you can use AI for some of the structural framing, etc., but the content very much we have another process of peer review and approval that things have to go through. We'll keep embracing it and using it, but ensuring that we've got good policy and good management around it.
Well, thank you for joining me today, Lisa. It sounds like you're on an amazing journey, and I look forward to continuing to follow you as it progresses.
Thank you, and just thanks to all the technology people out there that make this possible.